Now we will read about the thoracic inlet. The thoracic cavity, it communicates with the root of the neck through a narrow opening that is known as the superior thoracic aperture or thoracic inlet. Okay, so we should know the boundaries. Anteriorly there will be the superior border of the manubrium sternum. Posteriorly there is superior surface of the thoracic 1 vertebra, and laterally medial border of the first rib with its costal cartilage. Now let's see. So this is the thoracic inlet. That means it is a narrow aperture which connects the thorax and the root of the neck. Okay. So what we can see in the boundary, in the anteriorly, the thoracic inlet is bounded by the upper border of the manubrium sternum, and on each side it is bounded by the medial border of the first costal cartilage along with the first rib. This is the first costal cartilage and this is the first rib. So the medial border of the first costal cartilage and first rib, it forms the lateral boundary, and in the posteriorly there is anterior border of the superior surface of the thoracic 1 vertebra. Okay, so this is the boundary of the thoracic inlet. Now we should know a term that is the diaphragm of the superior thoracic aperture, or another name is the suprapleural membrane or Simpson's fascia. So from the name we can have an idea. This is a fascia, Simpson's fascia. So it is nothing but the part of the thoracic inlet on either side, on either side is closed by a dense fascial sheet. Dense fascial sheet is a suprapleural membrane, or you can see the Simpson's fascia, and it is tent shape. So what is it? It is a deep fascial sheet on either side of the thoracic inlet, and it is a tent shaped structure. Now look at that. This is the Simpson fascia, the greenish structure. Okay. Now the attachment and relations. The apex of the Simpson's fascia, it has an apex and a base. The apex of the Simpson fascia is attached to the tip of the transverse process of the cervical 7 vertebra, and its base is attached to the inner border of the first rib and its costal cartilage. Its superior surface is related to the subclavian vessels, and its inferior surface is related to the cervical pleura. That means it covers the apex of the lung. Okay, so the Simpson's fascia, it has an apex and base. The apex is attached to the transverse process of cervical 7 vertebra, and base is attached to the first costal cartilage as well as the first rib, and its superior surface is related to the subclavian vessels. That means subclavian vessels goes over the Simpson's fascia, and below the Simpson's fascia there is cervical pleura and apex of the lung. Okay, so what is the function? So why should we know this? Obviously, as it is deep fascia, it has some protective function. So what is the function? It protects the underlying cervical pleura. We already seen underlying there is cervical pleura and the apex of the lung. So it will definitely protect the cervical pleura and apex of the lung. Number 2, it raises the interthoracic pressure during the inspiration. As a result, root of the neck is not puffed up and down during the respiration. That means during respiration, it prevents the intrathoracic pressure, so that the root of the neck is not puffed up and down during respiration. Now we should know what are the structures that passes through the thoracic inlet. Through the thoracic inlet, some muscles, some vessels, some nerves that passes through. Okay. So we should know what are they. The muscles we will see later. The sternohyoid, thyroid, and arteries are the internal thoracic artery, brachiocephalic trunk, left common carotid, left subclavian. Look at that. This is nothing but the branches of the arch of the aorta. And nerves, right and left vagus nerve, laryngeal nerve, phrenic nerve, and the veins is corresponds to the artery. Right and left brachiocephalic veins, and some posterior intercostal veins and inferior thyroid veins. Just remember a few names. What are the structures that passes through the thoracic inlet. Okay, so this is a very good picture of the Simpson's fascia seen from the lateral view. So look at that, it is attached on the first rib in the one side, that is the base, and on the apex it is attached to the transverse process of the cervical 7 vertebra. And look at that, above the fascia, above the Simpson's fascia or suprapleural membrane, there is subclavian vessels, that means subclavian artery and subclavian vein, and below there is the cervical pleura. There is the cervical pleura, and underlying there is the apex of the lung. So it will protect the underlying cervical pleura and apex of the lung. This is a very nice picture. Now come to the next topic, that is thoracic inlet syndrome. If you have enough memory, you can have a look of this topic, but it is not so much important, although we will go for it. Now the thoracic inlet syndrome. Okay, so let's see what is it. The subclavian artery and lower trunk of the brachial plexus, these two structures that arches over the first rib, we already seen. Hence they may stretched and pushed up by the presence of a congenital hypertrophied scalenus anterior muscle. So if the scalenus anterior muscle is the congenitally bigger, that means hypertrophied, so the congenital hypertrophied scalenus anterior muscle, or if there is a cervical rib, this will leads to thoracic inlet syndrome. That means this will compress the subclavian artery and as well as the lower trunk of the brachial plexus and produces some sign and symptoms. This clinical condition is known as thoracic inlet syndrome. It's also another name is the called thoracic anterior syndrome, scalenus anterior syndrome or cervical rib syndrome. So what will be the feature? So due to the compression of the lower trunk of the brachial plexus, there will be numbness, tingling sensation and pain, numbness and tingling sensation along the medial aspect of the forearm and hand, as well as wasting of the small muscles of the hand due to involvement of the lower trunk of the brachial plexus. Number 1. And due to compression of the subclavian artery, we will get the features like this. There will be ischemic symptoms. Ischemia means lack of blood supply, lack of nutrition. So due to lack of blood supply, due to compression over the subclavian artery, there will be pallor, coldness of the upper limb, and there will be weak radial pulses, and due to compression of the subclavian artery. Okay, so we'll get two kind of feature. One due to compression of the subclavian artery, and we will get some ischemic features and loss of radial pulses, and another feature we will get for the compression of the lower trunk of the brachial plexus, and we will get the numbness, tingling, pain sensation along the medial aspect of the forearm and hand. Now we will learn about the inferior thoracic aperture or thoracic outlet. What is thoracic outlet? It is inferior thoracic aperture or thoracic outlet. It is nothing but a broad opening which surrounds the upper part of the abdominal cavity. Okay, and what is the boundary? Anteriorly there will be Ziffy sternal joint, posteriorly there is the body of the 12th thoracic vertebra, and laterally there is costa margin and 11th and 12th thoracic vertebra. So let's see it. What is thoracic outlet? There's no good picture. So we can see from this picture the thoracic outlet. Okay, anteriorly there will be Ziffy sternal joint, posteriorly there is the body of the 12th thoracic vertebra, and on each side there will be 11th and 12th rib. Okay, now you should know what is diaphragm of the inferior thoracic aperture. The thoracic outlet is closed by a large dome-shaped flat muscular structure that is called diaphragm, and it separates the thoracic cavity from the abdominal cavity. So that means between thorax and abdomen there is a dividing dome-shaped flat muscle that is called diaphragm. Okay, so it separates the thorax from the abdominal cavity. So its another name is thoraco-abdominal diaphragm, or you can call it the diaphragm or thoraco-abdominal diaphragm. And the diaphragm, this is the principal muscle of respiration. That means when we take inspiration, take the air into our lungs, this diaphragm helps a lot. Then we have to study about the diaphragm in the abdomen cavity, because the diaphragm is nothing but a dividation between the thorax and abdomen, but we will study it in the abdomen cavity. Now we will go to our most important topics, that is the sternum.